Hello, my name is Ashanti Wright, and I decided that I needed to know a little bit more information about the American Diabetes Association since it's such a heavy topic today's world that so many people do have diabetes. I think it would be good to see what organizations are doing for this community. Just to begin, the universal symbol for diabetes is this blue circle here. It was introduced in 2006 just to give diabetes a common identity, basically. So, across cultures, the circle can symbolize life and health, and it signifies a sense of unity. So, that was the biggest thing with choosing something very simple that gets the point across. As well as the blue color, um, reflects the color of the sky as well as the flag of the United Nations. And the United Nations itself is a prime example of how nations can come together. So, what is diabetes and a little history about that? One thing that I wasn't very sure on is diabetes a disability? And it is. So, under most laws, diabetes is protected as a disability, both types 1 and 2, which I'll describe later. And people with diabetes can really complete any task, any type of job, sport, or life goal. Under federal law, diabetes is a disability because it can substantially limit the function of the endocrine system. And it can be an invisible disability, as well as even if it's well managed, it's still considered a disability. With that being said, according to the International Diabetes Federation, 537 million adults are living with diabetes worldwide. The two types were first distinguished by Harold Hemsworth, and this wasn't until 1936. So, type 1 is caused by an autoimmune process, which means the body attacks itself, and the body, in this case, is attacking the insulin producing cells that usually regulate your blood sugar. Type 2 is when the body still makes insulin, but the insulin doesn't work as it should, and it doesn't regulate as well. In both cases, it's a serious chronic condition, and it occurs when raised levels of blood glucose or blood sugar occur because the body cannot use its insulin properly, or it doesn't make it at all. Insulin deficits, left untreated or unmanaged, can lead to cardiovascular disease, nerve damage, kidney damage, amputations, and eye diseases resulting in loss of vision or blindness. So, what is the ADA and how did the ADA come to be? So, the American Diabetes Association, sorry, the name sounds so long sometimes, was founded in 1940 by 6 physicians, and this was at the annual meeting of the American College of Physicians, and so the 6 are named there. In the picture to the right, there's a total, I think, of 12 here. I don't have all their names. This was the original founding committee after they already organized it. It's not too clear as to what sparked the conversation of the need to create the association. We can only assume that it's due to not having a delegated community or committee that can address the concerns of these diabetic individuals, because it really wasn't until 1959 where we even knew that there were 2 types. So we probably just wanted a specific committee that can dedicate acquiring knowledge for this purpose of knowing what diabetes is. The ADA is a nonprofit organization, and it's the only organization committed to helping children and adults with all types of diabetes, as well as those who are at risk. Their mission statement is to prevent and cure diabetes and improve the lives of all of people affected by diabetes. They mainly dedicate their efforts into expanding the impact in multiple areas, such as diabetes research, community programs, creating more advocacy programs, and public awareness. They offer quite a few services and resources for diabetic patients or people who just need more information on the subject. So, as of right now, 100% of donations fund research. Since the American Diabetes Association started its research programs in 1952, it's invested over $800 million in more than 4,000 diabetes research projects. And they have distinct categories which they focus on. This includes the 2 types of diabetes, pre-diabetes, people who have obtained insulin resistance, at-risk populations like obese individuals, as well as gestational diabetes, which occurs in women that are pregnant. They have a lot of patient education programs and resources. This includes step-by-step guides on how to look for the best pricing for insulin because it is so expensive. Different types of technology and devices that are available to monitor your blood sugar. As technology advances, they do address that, how hard it is for the older populations to keep up with making sure that they are monitoring their blood sugar. They have volunteers that teach diabetes prevention and management. They do this through state level chapters as well as church organizations. As well as they have their own program called Living with Type 2 Diabetes. Type 2 is not curable, it's a lifelong disorder or condition, and it's very hard to manage. So, having that one on one program that you can have is very important for those individuals. They have a website, Shop Diabetes, and this provides a lot of materials that you can purchase and have access to, which include professional books for people in the medical field themselves, which they include medical care information, clinical trial data. They also have books on clinical care and podiatry and more things of that nature. They also have nutritional guides available, knowing what food groups to eat. They have kitchen utensils that you can use for meal planning, and you can use those handed in order to better take care of your diet. They also have relief programs. These aren't direct, they're mostly indirect, where they support copay relief programs. There's an understanding that doctor's visits and labs and medications, they're expensive. And usually people are picking those high deductible insurance plans in order to make ends meet throughout the month. So these skyrocketing costs can really put a strain, and they just make care less accessible. And one of their goals is to make it accessible. So the ADA supports a copay relief program to make access to healthcare more affordable. They also understand the inconveniencing effects of natural disasters. So they also have a disaster relief plan that you can contact in case a natural disaster occurs and you don't have access to your medication, or because of the cost of rebuilding everything, you just can't afford yours. They also support clinical trials directly, and they support certain ones that kind of go with their goals of their research, as well as they provide a lot of resources of current clinical trials which we can partake in as the public. So the ADA has a lot of firsts. They are the only organization that really dedicates their goal to diabetic patients or people at risk, but they also have created standards. In 1986, they published the first national standards for diabetes patient education. This is updated every 5 years, and it provides the guidelines for operating a patient education program and what standards you should uphold. And these standards are usually upheld in order to bill for certain insurances and things like that. I didn't know this, but the first annual meeting was actually held here in Cleveland, Ohio, which is where I'm from. I didn't know things were that close to home. They also opened Camp Imagine, which is one of the first diabetic specific camps. And this is a place where campers can share and celebrate milestones, which I think is really important in making sure that we don't make people feel like they're alone. Some examples of some firsts that they can share would be changing your insulin pump on your own for the first time, or injecting insulin on your own. I used to watch my father inject insulin, and I thought it was a scary sight. I had no idea what was happening. He actually gave me the opportunity to inject insulin for him, and I was very young, which is very scary. But it just helps drop that barrier. You shouldn't be afraid of something that is a part of you. Another thing that's come to attention is that prior to the development of the exchange list, which I'll talk about in a moment, in 1950, meal planning for people in the United States with diabetes was very chaotic. There was no agreement among major organizations involved with diabetes and nutrition. So to solve this problem, the concept of exchange or substitution of similar foods was developed by the ADA and the U.S. Public Health Service. And the goal was to develop an educational tool for people with diabetes that would provide some type of uniformity in meal planning and allow for the inclusion of wider variety of foods, so you don't feel restrained or you feel like you just can't enjoy your food anymore because of a condition. So overall, the ADA has provided many resources that allow diabetic individuals to learn more about what they're going through, what others are going through, how science is trying to help them with research programs and clinical trials, as well as what's available and what are their options. Because a lot of time people don't know that they have options. I mean, some people don't even know that what their condition is considered a disability. So having that type of outreach program and advocacy is really important in today's world, especially when it's expected that millions and millions of people will have diabetes. It starts now with educating ourselves, and the ADA does a really good job of doing so. Thank you.